And when it comes to closing the supply-demand gap in healthcare, there are different ways to approach it. One potential solution on the supply side is to fast-track the licensing of internationally trained nurses across provinces. In Ontario, for example, almost half of all newly registered nurses come from outside of Canada. Alberta, BC, Nova Scotia, and other provinces have made similar efforts. Now, Erin, before we get to that, I do want to ask you, because as somebody who used to work at the bedside, is now in advocacy, tell me about your experience and even the decision to leave.
The decision to leave came as a difficult one for me, but I wanted to increase the advocacy that I could bring. Until December of 2021, I was a full-time registered nurse in an emergency department. And I saw firsthand throughout the pandemic, and certainly before the pandemic, what has occurred in healthcare. We had a gradual, insidious slide, and as the pandemic hit, we hit a wall or went off the side of a cliff. And through many factors, I saw many of my colleagues leave, both my colleagues in medicine, my colleagues in nursing, other healthcare professions. It was very difficult to see. And I realized that there needed to be more advocacy. So I stepped up into this role.
Dr. Ho, is the fast tracking of the registration for internationally trained nurses the panacea to solving this crisis?
I'm not sure it's the be-all, end-all solution. I think it's potentially one solution, but I think we're taking 3 steps back and 1 step forward here.
How so?
I think at the crux of our staffing shortages is Bill 124, is the fact that we've capped nursing wages to a 1% annual increase in the middle of a pandemic. And even the internal documents from the government show that it has contributed to the staffing shortages. And I've seen nurses in Ontario leave for other provinces. And so now we're talking about bringing those nurses or nurses from other provinces back into Ontario. It's sort of like we caused the problem ourselves, and we're trying to put a Band-Aid solution on this. But if we actually want to retain nurses in Ontario, we need to repeal Bill 124.
I mean, we need to pay our nurses fairly and ensure that they have a place of work that brings them joy. And those are separate but related issues. I'd also say, you know, there are health human resource issues now around the globe. So we also have to keep our crisis in mind that, you know, this is not something that's only unique to Ontario or Canada, although it feels sometimes like it is. This is something that everyone around the world is struggling with right now. And we have to look at what specific factors in Ontario are driving it, and I think my colleagues pointed to some of those.
How transferable, just going back to internationally trained nurses, Dr. Whatley, how transferable are those skills? Because there have been some who've said, well, there are certain limitations within the context of Canada's healthcare system.
Historically, Canada has always poached its doctors and nurses from other countries. And we could talk about the ethics of that in itself. Shouldn't we be training enough to actually care for Canadians? The key issue for me is, number one, are patients getting the nursing care that they require? I don't think they are right now. Certainly asking nurses to care for people lined up down a hallway, sitting in diapers, is a terrible situation for patients and for the people who are being asked to care for them. But second of all, I'd like to emphasize that nurses burn out and leave the profession based on how they're treated. And for knowledge workers, it's not just about carrots and sticks or how much we pay them. It's how we treat them. Do we give them the opportunity to control their environment, to make meaningful decisions, to feel like they're doing productive, meaningful work that they train to do? And so intrinsic motivators matter far more for nurses and for physicians.
Actually, let's talk about the ethics, Erin. This trend of Canada and other wealthy countries luring nurses from overseas. I mean, there's an argument to be made that it could create its own crisis in those countries.
And it has. Ontario is last in Canada for nurses to per capita. We are 24,000 registered nurses short at this point in time in Ontario. And the answer is to retain what we have, increase enrollment in schools, add stipends and incentives like we have done with other professions. You need only look to the Philippines. Ontario has siphoned off thousands and thousands of nurses from the Philippines and has created a crisis there within their nursing health human resources. I think, as a nurse, Dr. Whatley, I can tell you that compensation does have an effect on how we feel, how value is placed on our profession. It is not the only thing that has created this crisis, but certainly oppressive pieces of legislation, chronic underfunding has led us to where we are now.
I'll just jump in here on some of the points that have been raised, but one of the things that I think really has sought with healthcare providers during the pandemic is this concept of moral injury, where we want to provide a certain level of care, but we're not able to because the environment in which we are practicing doesn't allow for it. Maybe because we're being asked to do too much, or we don't have the time, we don't have the resources. And so one of the things that I think was, really positive actually about one of the other provinces, so British Columbia recently legislated some minimal nurse ratios, and I think that actually would go a long way in Ontario to supporting a better work environment for our nurses and reassurance to our patients that if you are actually admitted to hospital, this is the level of service that you can count on. So both the professionals delivering it and the patients receiving it would be on the same page.
All right, hold that thought. Coming up, we will unravel Ontario's move to boost surgeries at private clinics. That's next.